shot.
We are in the shot. Let me make sure. Yeah, we're in it. Okay. All right. Hi, everybody. Thank you for joining us. I'm Jenifer with Skin and Tonic, and I'm offsite today visiting one of my favorite people in the world here, Dr. Berry with Conquer Chiropractics in Brighton. So thank you for joining me today.
Thank you. I'm happy to be here today.
Today we are going to talk about something that is close to my own issues and struggles, and actually the whole reason why I'm in aesthetics, which seems somewhat unrelated until you kind of hear what we're talking about, but it's TMJ and migraine pain, and different modalities and ways to kind of manage the symptoms and kind of get that pain under control. And as we're heading into the holiday season, or actually well within it right now, a lot of people are probably experiencing some added tension and stress. So we're going to talk about a few points today of how you can kind of manage that and get some relief. All right? Okay?
Yeah.
So, our first question, and as you guys know, we've got some talking points, but this is all, I literally walked in the door 6 minutes ago, so it's all kind of off the cuff here. So Dr. Berry, from your perspective in chiropractics, how often do you see clients present with tension headaches and TMJ-related pain?
That is something that's a lot more common than people realize, and it's hard to differentiate between focusing on the jaw hurting and, okay, well actually I have a migraine, or was it actually caused by the TMJ dysfunction, then translating into the cervical spine and causing what's called like a tension type headache.
Okay, wait a minute, explain the difference to that again.
Of the tension type headache
Yeah.
versus a full-blown jaw pain, or differentiating between
Caused
the two.
from the TMJ and migraine. I think that's a distinct difference that I'm not even sure on.
So like a lot of people don't even think about it, but the parts of your teeth that come together, it's called the occlusal surface, and when those are misaligned, if you have like an overbite, underbite, or you think you might be someone that needs braces, anytime those teeth come together when you're chewing, or especially if you bite and grind, that's probably what most people would think of when they think of TMJ issues, because it's like, oh, I'm clenching, I can feel it in my jaw. But it's really important to have those occlusal surfaces that lining up, because if they don't, it changes how the jaw actually moves or articulates, and it can actually translate right into the jaw, and it's actually connected if it goes straight back with the muscles related to the upper cervical region. So the base of your skull and the first two vertebrae are commonly affected by that. And what it will do is cause that to be misaligned. Then once you're altering that structure, it changes the function. So now the muscles are pulling and acting in a different way, and that's actually grabbing the connective tissue that runs across the top of your head, and it will cause like a tension type headache, which a lot of people will feel right across the forehead, in the temporal region, and then sometimes even they'll still have the jaw pain and tightness that you would commonly associate with TMJ.
You just like explained my whole head. It is the pain that I deal with very often. So I was excited to talk to everybody about this because I see it a lot in the clinic too. Then a lot of people don't know that for me, this is actually why I entered aesthetics, because I found this solution using multiple modalities, but the Botox to treat the masseters. So I am very passionate about it, but it is my specialty for injections. All the aesthetic stuff is just extra bonus. So let's talk about how does stress play into this, especially during the holidays and physically contributing to the flare-ups.
Oh yeah, I mean, so especially when somebody clenches when they're stressed out or irritated, or your mother-in-law's in town and she's telling you what to do. I'm kidding, I love my mother-in-law, she's wonderful. If you're watching this, I love you.
I love you too.
But anything that would cause stress to go up, right? A lot of the times you're clenching your teeth, trying to bite your tongue, quite literally, actually. And it's on a physiologic level. What happens when you're stressed is cortisol is released, and cortisol is actually inflammatory, so it'll make it worse. So you're going to clench more, the muscle recovery is slower, it kind of dumbs down your immune response because you're in that constant fight or flight state. and it really just hinders your body's ability to adapt to the stressors that are put on you every day. And then you basically go to sleep, grind your teeth all night, wake up with a sore jaw, and rinse and repeat. So it's really hard, especially when you're in this high stress situation where you're, whether you're hosting or planning to travel or just trying to orchestrate the whole holiday season, really.
Yeah, it's a lot. It is definitely. And then when you, like you said, you're hunching all night long, so when you wake up, you certainly don't feel rested.
No, absolutely not.
So there's definitely some options that maybe some of you don't know about. What are some signs that someone would look for that might indicate that their headache or facial pain is actually linked to TMJ? Again, we're trying to differentiate. We're not diagnosing anyone here, but we're trying to help you delineate, do I have TMJ or migraines? And then who would you go see first to manage that, diagnose that, and then we'll kind of get into some options on treating it.
Yeah, absolutely. So, I mean, obviously the most common thing that people are going to see is they're going to wake up, especially after a night after like a high stress day, you'll have that sore jaw. And you wake up and you're like, ooh, ow. And it's like clicking and it's not really doing what you want to do. And sometimes, like in really bad cases, what'll happen is you'll get what's called lockjaw. So you'll like open your mouth to take a bite of something, and then your mouth is stuck open. And that's the joint actually getting stuck and fixated to a point where it can't close. So then you have to like wait for it to unlock itself or like force it shut. And people in those instances then, they start to not open their mouth all the way. You'll see them because they'll start talking like this because they don't want to move their jaw. So they really get this like it adding to the tension. And when you decrease the range of motion and stop using it, it tends to lock up, freeze up, and exacerbate the symptoms, which you don't want to do. And in those instances, a lot of the times, there's not a whole lot that can be done when we get to that severe, I can't do anything point, because we've waited too long to address the problem. So we think it'll go away by itself because that's what it did in the past.
No, absolutely. Absolutely. All right, well, let's see. What signs would someone look for that might indicate that it's related? So the other things other things we were wanting to mention was cracked teeth, fractures in the teeth from grinding at night and clenching. Usually your dentist will usually kind of clue you into this. They'll ask you, do you grind your teeth at night? Because when they're cleaning your teeth and they're seeing them worn down or frequent cracks, that's definitely an indication. And then if for some reason I were to have a client in my chair for an aesthetic purpose, because you can inject the masseter muscles, some people they want their profile to look a certain way, and if the masseters are enlarged, it can kind of give more of a peanut shape to the face, which is not something that women feel is aesthetically pleasing. So we can inject these to slim that muscle down. But if they notice that they don't have pain later, that might be an indication that, well, these masseters are enlarged because you have TMJ and have been grinding and they've gone untreated. Yeah. So it can kind of go both ways. That's lesser way that we usually kind of come across it though.
Yeah. Are there other areas that you might like incidentally inject that would actually make that feel better as well?
So when you're injecting Botox for migraines, we treat a little bit more lateral on the lateral aspects for migraine pain than we do aesthetic. Aesthetic tends to be more midline of the face. Depending on where it's occurring. The occipital sometimes. But certainly, if you get aesthetic treatment and you do notice that an incidence of migraines have gone down or you're just getting less headaches, that could be a tip into it. Occipitals, I don't think it's a surefire way to think that you have TMJ or migraines, because I think a lot of that can be tension and just relaxing those muscles. Yeah. I find a lot of the relief is when I inject trapezius. I've had a few clients that a physical therapist friend has sent over to me, and I thought I had the world's worst traps. They're just always tight, and this was like, it was like a brick. Like, I touched it and there's no push. There was just a solid rock, and I didn't even know. I was like, gosh, I don't even know if this is gonna work. And it took us a while. I think it was a full year of treating her before she was no longer walking misaligned, literally walking like this, that I could actually push and actually palpate the muscle, and she got some relief. So that was really exciting to see, and of course for her, not being in so much pain.
Just thinking about the quality of life there.
There's other areas you can inject that are maybe not necessarily TMJ, but people don't realize Botox is not just for aesthetics. Sometimes people will inject calf muscles, right?
Yeah.
If they've got Charlie horses a lot, or aesthetically, women want more slender calves. But there's actually a lot more uses for it. I think one of my favorite stories, and I'm getting total squirrel here, but I know of a surgery that they went in to do the surgery on an abdominal wall, and because the muscles would not pull back together, the surgeon injected the muscles on the abdomen, closed, did whatever the closure is to have an open wound, waited a week, and came back in, and they were actually able to finish the surgery because now the muscles were relaxed enough that it came back together. I don't know. That's just
surgical implementation as well.
Yeah. So it's not just all
This is a good thing. She's excited about it, and I love how excited Jen gets about it.
Fascinating to me. That's the cool stuff about Botox and aesthetics to me. All right, let's get back online here. I don't remember what this one from. Oh, this is for you. So from a chiropractic standpoint, what structural or manual therapies help relieve TMJ and neck pain? So what other things other than doing the injections?
Other than the injections, which, by the way, we've co-treated a few patients with migraines with TMJ. It works so well. Makes my job easier because it's it just works so well together. But for me, a lot of the structural things that we talked about before too, occiput, your first two cervical vertebra, those are the ones that most commonly get misaligned when we're working with migraine or TMJ issues, because it translates from straight from the jaw straight to T1. Or not, C1, sorry, so there's your first cervical vertebra. T1 is in your mid-back, but we'll get to that later, talking about the traps over here. But so those are the most common things, as well as the TMJ joint itself. And obviously, I'm a chiropractor. I love adjusting those areas. It is effective, and it's a less invasive method of treatment as well.
Yeah, you see me on the table,
She gets a foot popping adjustment. It's fine.
Yeah, I do.
We have fun.
We have a lot of fun.
But I do like to utilize a lot of hands-on trigger point pin and stretch exercises in the neck and shoulders to try and loosen that up. That way, when we adjust, it helps the adjustment hold a little bit longer. Relief tends to last a little bit longer. And then I'm also one of those really mean chiropractors. I do intraoral.
It's a little weird. It might feel a little weird at first, but it actually, the relief is phenomenal.
So when I say intraoral, it means that I'll go into the mouth from the inside and strip the muscle down around the TMJ so that it loosens it up, so it frees up that motion. That way you're not getting lockjaw. You can typically get better range of motion. Take that big bite of burger that you really want to have for lunch, right? So I like food. I'm sorry, we'll talk about it a little bit. It's all right.
I love food. Yeah, I like that. Yeah. Well, and I remember before I got mine under control, trying to eat a Panera roll was near impossible. I could not finish chewing it. My jaw would almost give out. I would try really hard because I love bread, but now I don't have that problem.
Now, what does that feel like? Is it like a tired feeling? You almost can't finish chewing because your jaw hurts and it just feels fatigued?
It's more than fatigue. I don't know that I can articulate a word for it, but it's just given out. I think it's I don't know, when you're doing a wall sit for more than 5 minutes and then you can't stand up or sit down anymore and your body just gives out and you fall to the ground. It just gives out.
Just ruins the whole meal. Just done.
No.
Yeah. Who wants that? I want to finish it.
Those
rolls are
good.
I know. It's lunchtime, right?
I need lunch. what have we not covered? Trying to think. So, as I mentioned, I've had TMJ migraine since I think I was diagnosed when I was 7. I've had braces twice. I've had every type of bite guard made for my mouth known to man, and although they work great for some people, so that is definitely one step that you will want to try is a bite guard that you wear at night. It just didn't work for me. I did go to an oral surgeon that this only surgical repair for it is actually replacing the joints for the masseter.
Oh.
And I didn't know this until I had gone to the surgeon, which there was only like one guy in the entire state of Michigan, by the way, and he was like 100 years old. God bless him, he was really smart, but hopefully he had an intern or something. But it's the only joint in your body that you can do a replacement once. So at 35, I was looking at one and done. I'd be wired shut. Now some people might have liked that, but I didn't think that was a great solution. In like 8 to 10 years, when that joint would give out, you couldn't replace that joint again. At least that was the technology back then. Don't quote me on that. So I opted not to do that. That was what pushed me to kind of look for some alternatives, and that's when I found Botox as an alternative.
Okay.
Yeah. If you would have asked me 10 years ago if I was doing aesthetics, this is not what I thought I would be doing. This is actually the passionate part about it for me, and all this other stuff is just kind of bonus things to do. But dry needling was something that helped a lot. Frequent massages, like scheduled massages. I try to get a massage every 2 weeks, and sometimes I hate saying that because it sounds a little bougie. But it's really like I would give up like lashes, nails, all that other stuff. Like I need my massage. If I don't, I guarantee you within a week or so I'll end up with a headache.
I feel like there's been a really big shift too to where massage and chiropractic and even aesthetics too is more, and like Botox injections specifically have been viewed as this like not a necessary part of life until you start doing it for a reason outside of outside of it, like where you're having pain or you're trying to find some relief from something that'll work for you, something that might work for somebody else.
I mean, I think it's just preventative, right?
Yeah,
I
it's
really
preventative.
feel like
It truly is.
you're right. I think that all 3 of those things are preventative, and even if I'm talking about Botox for aesthetics, I've seen a big shift. When I first started, I thought I was a little bit of an oxymoron. I'm like, I was a doula, I was, wanted to be a midwife, like I'm a little more holistic. What am I doing? Like, do I even make sense to be in this industry? But I kind of came at it more of a standpoint of regenerative. I learned what dermagel was, and I do a lot of dermagel. I still do all the fun stuff, the sculpture and the filler, just not as much as other injectors. And there's a person for a specialty everywhere. But now this industry has made a shift more to regenerative, and so I think that plays into the self-care aspect of getting the massage, doing chiropractics regularly instead of waiting until you're in so much pain and now you have to go because you don't have a choice to do anything else. But if you were doing it all along, then you would maybe not get to the point of being in pain.
It's all about the adaptability of the body. If you do consistent self-care and preventative things to obviously prevent the discomfort, you won't have that level of discomfort, right? So it's all about adaptability. The more frequently you do something to help stimulate, repair, and keep the longevity of your body and everything going, then it's going to take less time to recover from any kind of injury, and it's just really important to do that. And like oh my gosh, I didn't even know about the benefits of Botox injections for migraine and TMJ. I was one of the ones. I was one of the ones that was like, oh man, get the face right. And so I didn't even know the therapeutic benefits of Botox injections. I always thought it was an aesthetic thing. And then I met Jen over here.
Really?
And she opened up my eyes, was like, hey, you know what? This works. And so we started, we have a couple patients now that we work together with, and the results speak for themselves. express how awesome that is for not only the patients that we co-treat, but the relationship that we have as well. It's exciting. We get together and we're like, oh yeah, have you seen so-and-so? Yeah, she's doing great.
No,
so
I love when I get to see her come in and she's smiling and she's not in pain.
Yeah.
So how, let's talk about just a little bit about frequency and duration. So I know for me, it's for the most part, Botox is about 12 to 14 weeks in efficacy. But that said, when you're treating triggers in TMJ, it can vary, and it can vary greatly. Some people could get as little as 8 weeks of relief, depending on how severe it is, how long they've gone without treatment. And then I am now to the point where I might treat myself every 5 to 6 months. So I get more time out of it. So it will range, but I would say the estimate would be 3 to 4 months is about how long it would work. What about chiropractics? How often do you recommend?
So for chiropractic, for somebody that's in perfect condition, right? That's not how anyone ever comes to me. I'm sure you know.
Have you ever seen it?
People come to me when they're like, oh, I'm in a lot of pain, I can't feel my leg. But once you get to that maintenance level, people can go once or twice a month. Sometimes they go every 6 weeks. But we call that maintenance care. And when I think about maintenance care, it's all about maintaining current status. So if you think about it like that, it makes a little bit more sense. If you can't feel your leg, but you want to do maintenance care, I'm going to tell you that's not going to work, because maintenance care is just going to keep it the same. So the intensity at the beginning tends to be more for chiropractic when you're in that acute stage of healing. Like you have a migraine every other day. You can't open your mouth right now to eat. That's when you have a higher intensity. But when you get that relief and it feels better and the adjustments are holding longer and you're not really having a whole lot of issues, that's when you transition into maintenance care. Where that's that once or twice a month kind of thing, where it just keeps the body adaptable, makes sure that everything's functioning properly. It's like a check-in.
It is check, and I think for myself, twice a month is where I sit really well. If I try to squeak out a little bit of time in between for whatever schedule reasons, like, oh, I'm fine, I'm not having any pain. Darn, if 2 days into that, I'm not like, oh my God, like I can't get in. It's Saturday night.
She goes to 2 volleyball games in a row. That's
probably all the filming. But,
yeah, that's right.
But yeah, I think like if I'm consistent with my massage and the chiropractics in every 2 weeks, then I really don't get into too much trouble. I think anything else we could recommend? I know trigger point therapy is something that's popular. I'm not going to get into that today, but that is another thing. I do a little bit of it, but only from the jawline up. I do have some referrals that I can send people to if that's something of interest. But either way, if this is something that you struggle with and either Dr. Berry or myself have said anything that kind of has caused you to pause and you have some questions and need some more information, you can always contact us at the clinic. We can refer you over to Dr. Berry, or can you explain I don't know what complex this is called?
Oh yeah, it's Grand Crossing. This is where we're located. The UPS store in Brighton, Mancino's. We're going to talk about food. I'm sorry.
Oh, cookie crumble.
Yeah, crumble cookie, right?
Yep,
We crack you before you crumble. All right, yep. I don't know if you want to do that, but I did. So, or Bush's, Kroger. A lot of people know where those are at. Obviously, if you have any questions about it, you can reach out to either one of us. We'll be happy to help you out with that.
Yeah, and I'll put up his contact information on the bottom of this video, and then we always send the replays over to our YouTube channel, which is Skin and Tonic Brighton. Well, thanks so much for doing this with me today.
Absolutely. Thanks for coming out, including me, and just giving us the opportunity to talk about how well we work together.
Yeah, and we're going to be kind of venturing out over this way. I talked to my friend over at Healthies. We're going to do some fun stuff in January with them over there. So I was just going to say something else and I completely remembered. So that means I'm done. All right. So you guys have a great week. We're going to see you next week. That will be our last live for the year. So it'll be a special one. And if you're a current client, you will want to tune in. Okay. So have a great day, everybody.
All right. Thanks for having me.
That was fun. Let's see. Figure out how to do that. I do better when I'm not reading off that thing either. Oh. See, the tape worked.